Hi, everyone, and welcome to a new episode in our series for UX healthcare, in which we're talking to different professionals in the UX field who have chosen to focus on healthcare. In the series, we're talking to them about what it means to be in the field, how they got into it, what is currently happening, and what this particular episode will focus and we'll talk a little bit about the UX Healthcare Conference that is coming to Berlin on the 19th and 20th of September. So in a couple weeks from now. Well, so our my guest today is Dr. Gyles Morrison. And Gyles, welcome.
Hello.
How are you this morning?
I'm good. I'm good. I'm tired. I think anybody listening, if you're a parent, you can relate to being tired with the children waking up earlier than you would hope. But otherwise, I'm well. It's good to be here. Thank you.
So happy to have you. Like it's such a person. I think not a person. I want to say a staple of the UX healthcare industry.
Mm.
I think it's if you say Giles Morrison, people immediately know who you are. So it's a pleasure to have you here. And yeah, we both are deeply involved with the UX Healthcare Conference, and we're going to talk more about it in a few minutes. But for those who don't know you, which I don't know who that would be, who are you? Tell us more about you.
Cool. So yeah, my name's Dr. Gyles Morrison. I work as a clinical UX strategist. I've been in the field for 10 years now, 10 years as of September 3rd, 2024. And my work focuses on the experiences of clinicians and patients and when they're utilizing healthcare technology and services. So I used to work as a medical doctor. So my doctor title comes from my medical degree. I didn't do a PhD. I don't think I've got the patience to do a PhD. But it's been really a pleasure working in this field. It's been stressful. As we all know, the job market over the last couple of years has not been great. The poor understanding of UX by employers, by HR managers and the like, hiring managers, means that it can be quite stressful when you're wanting to work in this field. But there has not been any greater need than specialists working in healthcare UX than now. As we are aware, there's this huge rise in the use of AI in healthcare, and this is causing some problems because really it's not delivering what it can do, like its potential technology. It's an emerging technology that still needs to reach its potential to really deliver on what it's promising to do. And there's a lot of work that UX professionals specializing in healthcare need to focus on. That's why I've devoted my career for the past 10 years looking at digital therapeutics, behavioral science, looking also at ways to support marginalized groups and overcoming healthcare inequality. And I train people to work in this space as well.
I'm trying to hold back to not talk about all the issues that AI has. Like, if anybody watched my interview with Thomas Wilson a couple weeks ago, then they know that I have a lot of thoughts on that. I'll just like share one. Mm-hmm. It's how AI is seen as the silver bullet. It's going to solve our problems. But my fear is that it will just widen inequality, just like make these larger gaps. It's this assumption like, oh, everybody will have access to this technology. And I'm like, okay, who's everybody? We still have in the world people who don't have constant access to electricity, people who don't have internet in their house, people who are struggling with issues that AI can just not solve. And that's why we need people, human-centered user experience professionals that will actually shed light into these problems. And for the companies that are trying to like push AI, be like, hey, there are other things that we need to solve. Nothing against AI. I think it's a great technology. I just say, like you said, it's an emerging technology and still has a lot of work needs to happen before it can do everything that's promised. So I'm gonna leave it there because otherwise this would be a larger conversation. But yeah, I would love to know. Like I already know this, but I think it will be very interesting for everybody. Is how did you transition from, because you have transitioned a lot from from working as a physician to working as a UX strategist, and you're also a speaker. Like, how did you get into speaking? Like, what was the journey like?
Yeah, so I've always been quite confident in speaking with people and sharing ideas and getting other people to understand what's possible, probably from quite a young age. So it's never so much about acting, although I've done some acting, but it's about my very strong passion and desire to help others. And so that lends itself to speaking, because if you are a professional speaker, you are really supposed to be inspiring and educating people, but a lot of people at the same time. And it lends itself and overlaps with the work of being a teacher. So when it comes to being a speaker specifically in UX, I started to really take that most seriously from around 2016. This is where Theo Sauls, who is the organizer for the UX Healthcare Conference, invited me to be a speaker for the UX South Africa conference. And this was in Cape Town in November of 2016. That was my first ever international speaking opportunity. And I gave a talk a lot around my transition from working as a doctor into clinical UX. And before that, I would also be doing some talks primarily in the United Kingdom, specifically on that transition of moving from medicine into a UX role or otherwise changing careers. That's another one of my roles, is that I work as a career coach, particularly for clinicians. But it was that opportunity in South Africa that really opened my eyes to my ability to be able to inspire and educate people on a stage as a professional speaker. And I've never looked back since.
Amazing. Like, yeah, you have a great voice. You have a presence to you. As somebody who has heard you speak and has seen you moderate, because you moderated the UX Health Conference in Amsterdam. It's the first time that I saw you live on stage, to be honest. Like, I had seen you on Debbie Levitt's show. I had seen on, well, Debbie Levitt's content and other like online conferences, but that was the first time that I saw you speaking live, and I was like, he has a presence, a velvetyness to your voice.
Thank you.
Like, you don't need to be loud nor to be like commanding of a room. So I really appreciated anybody who gets to hear you speaking live is in for a treat.
Thank you.
And if you can talk a little bit about like what are you working on right now, because sounds like you're juggling a lot of things. Like, what are, if you had to highlight something that you're working right now or that have you worked in the past few months, like what would that be?
Yeah, so it's a combination of things, really. So working as a consultant, as a contractor, means that my work can be quite varied. So very recently, I was working on a project with a pharmaceutical company, and that involved a lot of research, looking specifically at how we could be using generative AI to improve some workflows. And that's a very common type of project that's happening for a variety of professionals, is what does it mean to bring AI? Rather than let's just create the AI tool, actually let's first make sure that what we're proposing to make is actually going to solve a real problem, which means understanding the users who will be impacted by this AI tool or who would even be using the AI tool. But another side of the work I do, as mentioned before, I do a lot of career coaching, but I also do UX mentoring. So I've had some clients recently who I've been supporting. There's one particular client who, quite frankly, have had a very, very bad UX manager, and it was really terribly affecting their mental health. So he's exploring ways for them to take more control over the situation and not be robbed of their ability to work effectively in their job, but also not robbed of having the pleasure and joy of life in general outside of work or inside of work. So we had some sessions to go through that, and that's had positive impact for them. Then the other really exciting venture, I've started some recordings now for a new podcast called Dialogues with Dr. Gyles Morrison. And this is where I interview different people from all kinds of backgrounds, so not just in UX. And that's a way of us learning more about the inspirational story and some of the great work that they're doing. So tune in for that later on this year. And I'm also proposing to do a show specifically on clinical UX, something where people can learn not just from an educational point of view, but be inspired by different types of projects and also the latest news that's happening in the digital health and innovation space.
Incredible. You're somebody who stays busy,
Yeah.
and you're you're constantly adding value to the community, which I think it's wonderful. There's a lot of people, like I think you especially see it now on LinkedIn, people just like putting out content for the sake of putting out content is I think it's a really funny trend on how getting at like this post is like how getting engaged in Bali made me learn more about like NPS.
Yes.
That
Random stuff, random stuff. Like I remember there's a lot of marketers that do this. They will use the latest news or some really, really old content, but that had gone viral for another company, and then just do a post about that. And because the image that they're using or the video that they're using is very memorable, that's what's getting loads of likes. Because you'll be surprised how many times people react to a post that they have not even read. They've not watched the video. They've not read the text that was written. They just like the image, or they like the video. They like the person that's involved with it. So they
Mm-hmm.
don't even really digest the content. And that's definitely happening in the UX space in general, but also can happen in healthcare as well, particularly content around AI, if I'm really
Mm-hmm.
honest. And it's noise. There's a lot of stuff out there which is not there to really make a positive impact on people's lives in general. It's really for the poster to just
Yeah.
get more likes, more attention. And people may notice I don't actually write that many posts. I actually am much more likely to leave a comment on posts
Mm-hmm.
or to share someone else's post than to
Mm-hmm.
write my own, because there is a lot of good content on LinkedIn, but there's also a lot of nonsense as well. So
Yeah.
I'm trying to not just balance it out by producing my own content, but balance it out by actually commenting on good posts, but also commenting on bad posts. And if it's really, really bad, just blocking the author, because I don't want that stuff coming up in my feed.
Yeah, no, I'm 100% with you. I remember I had this. It was me and Thomas Wilson having this discussion with somebody on LinkedIn because
Mhm,
they created this post and the post had the R word in it,
mhm.
and I was like, "This is." I mean, if you're, it's in some cases it makes sense. Like if you're talking about how damaging the word can be, or if you're a
Yeah.
person who is appropriating that word
Mhm.
and using it themselves, then I get it. It's their situation. They're saying, I'm gonna own this word, I'm gonna take away the power from it, so they use it. But this was not, he was just using like that word, and it's like, okay, there's like correctness, like we have some like not PC culture, but it's like there's some things that we say and with things we don't say, and that can apply to particular words related to race, particular
Yeah.
related to gender, to sexuality, so you just don't use some words.
Mhm.
And then after a few exchanges, the guy was just like, well, I didn't write this post. I just wrote it with AI. AI added the word for me, so I'm free.
Even
I'm
worse.
free of all
It's
guilt.
even worse, to be honest. That read
Exactly.
it, or did they even read it? They just copied it
Exactly.
from AI. Did they even read it?
It's which I think it's worse than just liking a post. It's like you're not even reading what you're writing. So you're just like putting your name next to something and saying like, well, yeah, that's AI did it, which I think it's one of the dangers when it comes to AI, that you just like create things
Yeah,
and it absolves you from all guilt. It's like it
yeah.
doesn't absolve you from all guilt. It's you're still responsible for what you put out in the world.
Mhm. But this is why I have serious concerns about it in healthcare, where AI, if you have inappropriate trust for it, so that you don't then necessarily vet all of the information that is produced, or you don't fully understand it's working out, because a lot of what goes on with an AI is in a black box. You can't understand
Mhm.
it. And so if you can't understand why it's come to a conclusion and blindly trust it, and it's made a mistake, and this is in the context of a clinician being
Mhm.
given instructions on what best to do with the patient, but the AI has got it wrong, but you blindly trust it, this could harm patients.
Yeah.
This is why whenever we're talking about AI being used in healthcare, we should think, well, where are the processes in place to protect clinicians, protect patients, to make sure that we're getting the most out of this? There should always be a human in the loop. There should
Mhm.
always be transparency on the working out, and there should be a process of formally reviewing what is actually the content, the information being produced by the AI. Because when it gets it wrong, in certain situations, it can cause fatal harm.
Totally. I 100% agree with you. I gave a talk at the Erasmus MC, so a hospital here in Rotterdam, recently. It was to a group of designers who wanted to get into the field of healthcare, like those have an impact in healthcare. We are talking about it. And I was telling them like how different it is, because everything's like, oh, it's all user experience. And I'm like, there are different levels of user experience. And
Mhm.
particularly in healthcare, you have a heightened risk because you can actually harm a human being.
That's
And
right.
your quote unquote users, it's not the user that goes, for example, a retail experience. It's like if you have a bad retail experience, okay, you just struggled to buy something or to sell something, or it was annoying. But
Hmm.
there's an added emotional load to a patient or a family member of a patient or a caregiver or a clinician or a former caregiver like a clinician. There's an added emotional load to
Hmm.
them that needs to be taken into account. And AI, it's not a human. So they're not gonna they look at data, they don't look at the people who are going through it. And that's why you need to have that human involved. And that human cannot just be any old human. It should be a human that has, for example, trauma informed training,
Yeah.
which a lot of people just toss to the side. It's
Hmm.
like, oh, I'm just I recently heard an interview in the Human Centered Design podcast.
Hmm.
It's an interview from May. I think her name is Jenny Whitefield. I think that's her name. It's Jenny W, but don't answer the last name right now. It was about trauma informed training, and she did some research on a women's prison, and she was coming in, and she really took like she did a training and everything to certify herself, and she talked about like how when you're interviewing somebody in a position, a vulnerable position, you have to have a different they will open up to you, and the second that they open up to you, you're making a bond.
Hmm.
And that how as a researcher you have to keep distance. You have to say, I cannot make promises to you, so you're
Hmm.
telling me about all these things, I can probably not fix them. And be
Yeah.
very honest and open about that, and also be able to put the brakes. And then it's like, okay, you're telling me there are these very emotional things. I am not a trained psychologist, I cannot help you process this. I be responsible for what's going to happen after you leave.
Hmm.
And a lot of people are not informed about that, and they just say like, oh, I can jump into this, it will be perfectly okay. It's like, you don't know that.
Yeah. It's a really interesting point you raised there because you find that even in medicine, there's a lot of problems that patients have that simply the doctor cannot solve.
Mm-hmm.
Recall a young lady who came. I was working in obstetrics and gynecology, and she had bleeding
Mm-hmm.
between down below, and it became apparent that this was from having intercourse from a one night stand.
Mm-hmm.
And her boyfriend is in the room
Mm-hmm.
admitting this,
Mm-hmm.
and she admitted this, saying that actually this happened when she was heavily intoxicated, very drunk,
Mm-hmm.
and she started crying, asking desperately for help.
Mm-hmm.
It's not so much because of the bleeding or pain, but because she knows that she is an alcoholic and she's desperate for help.
Mm-hmm.
And I remember thinking that obviously I need to rule out if she's got an infection because, she's had a new sexual partner and things like that. And I discussed it with the registrar, and all he cared about was just that. Has she got an infection? Nothing to do with the mental health problem, the fact that she's desperate for help with her alcohol addiction.
Mm-hmm.
And this is a problem that doctors should be able to help with. But in reality, you'll be surprised how often doctors are disempowered, be it by their seniors or by the system, the process in general, to really give the help that people need. And
Mm-hmm.
I think it's important that UXers working in healthcare understand these sorts of realities. Like, we know that healthcare is not perfect and we know people are not perfect.
Yeah.
What does that actually mean in the context of designing a solution for clinicians working in healthcare?
Mm-hmm.
You need to still go back to the basics of observational studies, contextual inquiry, task analysis, really understand what's going on, use behavioral science to see out of all the potential people who could use your product, who are the ones that are going to have the biggest problems and why. And with that understanding of their personal professional background, the truths that they believe in, the truths that they accept from people in authority to them, the
Mm-hmm.
resources and control that they have over the work that they do, this then impacts their behaviors. And it's not easy. I'm not saying that this is a 5-minute task. No, it can be
No,
weeks,
it's not.
months, years of work. But it's that deep insight and testing of solutions, iterative design allows us to provide services where the doctor may not be ultimately involved. That young lady who's got this alcohol addiction, it could be another service that helps her that may be even digitally driven,
Mm-hmm.
just recognizing what is the different touch points that this young lady could have with healthcare, be it with a human, service, with technology that can give her the support at the moment that she most needs it. So again, there's no easy way to overcome these issues, but it's recognizing these realities and having them as a design constraint, having them as the problem that you're trying to solve, having it as a focus, and then going wild as a UX professional using all the wonderful skills and talents that we have been developing over the decades.
Yeah, com- uh, that's your. I think you're totally correct. And the part like, that really resonated with me, the part that humans are not perfect. It's like, of course, healthcare is not perfect. Humans are not perfect. Do
Mhm.
we use that as an excuse to say we cannot do better because nobody's perfect? Or do we say we understand the like you said, the constraints that
Mhm.
can be culture? I think as design, like what I see most often that I really dislike and really impacts me, it's how in many situations when designing solutions, the designer or the startup or like who is working on it, it's completely unaware of social economical
Yeah.
restrictions that users might have, and saying like, I remember that I saw this solution online. It was just a case study, like it wasn't really a solution, but it was like highlighting how great it was to use technology,
Mhm.
particularly for weight loss. And it said like, okay, so this is the user started using our app. She could talk to her doctor every day. The doctor was very understanding and everything. And I just commented, okay, this user lost 40 pounds in 6 months. That's great for her. This user does not exist. At no point did you mention the mental health aspect that comes with like because it was an obese user. It's like
Mhm.
at no point, and it wasn't a real person. It was a make believe user.
Mhm.
There's a mental health strain that comes from people who get to this point. For many of them, you didn't mention that this person doesn't appear to have a job, doesn't appear to have a family, appears to have access to healthy foods every day, 3 meals a day, which is a very rare thing. And we need to be aware to those constraints. We need to be aware of those possibilities. Also, like there's cultural barriers, reasons why people don't go to mental health support. There's reasons that maybe if you cannot afford, if you have two jobs, how are you going to balance as well your nutrition, or how are you going to balance your healthcare? There's multiple reasons why things might not work, and in this field particularly, we have to be extremely aware of those and be able to propose solutions that are not just pretty on paper, but they're also possible in the real world. And I think you'll learn it with experience. It's you should train yourself, but also like learn from others. Go to conferences, talk to people who are more senior than you, see how they dealt with these problems, and that's the point in which we can say, okay, we're learning from each other and actually growing as professionals and making the industry a better place.
That's actually what I really love about the UX healthcare conferences is the whole purpose of bringing these people together is so that there's a shared understanding how best to work as UX professionals in healthcare. I have done a lot of projects over the last 10 years of my career. I've seen some really interesting people work with really interesting people. And not all the projects lead to a product or new service that's put out there into the world. But there's a lot that I've learned. But what
Mhm.
I've learned is only going to have the impact that it deserves if I share this with other people. It can't just be the people that were on the project with me, especially if I was the only UX professional. Because
Mhm.
how does that learning then get embedded into the way that we provide new solutions in the future? Because I can't work on every healthcare UX project in the world. So by going to the UX Healthcare Conference, you've got an opportunity to learn not just from the speakers, but from fellow delegates who are also healthcare UX professionals. Sometimes other type of disciplines too, but they tend to be UX healthcare professionals themselves who've also worked on so many different projects with wonderful people from around the world. And by sharing what we've learned, what's worked, what's failed as well, we can all grow as a discipline, as a profession.
I think this is a perfect segue to talk about what people can expect from the UX Healthcare Conference because Berlin is coming up next.
Mhm.
I mean, like you said, we have great delegates, great speakers. I would love it if you could tell us more about the special what we have added for this session because we have added a lot of two very interactive ones. Like, can you tell us more about it?
Yeah, so for the upcoming conference, we've been listening to some feedback that we've got from delegates and been reflecting on what has worked and what could have been a bit better over the years. Because our first conference was back in 2018. So for this conference, we're introducing as very fixed sessions now a design discussion, sort of like a design critique, where everybody in the audience can participate, including the other speakers, on looking at a particular idea or concept and working together to evaluate it and provide constructive feedback and suggestions of next steps on how to work on that concept. And we'll actually be deciding what those topics will be on the day. So we have that on both days, this design discussion, and through a discussion briefly with the whole audience, we'll decide what is the project we're going to be discussing. And then at the end of each conference day, we'll have a panel discussion where the speakers of that day are going to be sitting in the audience, but we're all having a wonderful discussion on a particular topic. And again, that topic that we discuss will be decided at the moment. So it allows these design discussions and panel discussions to be as fresh and as relevant as possible and most engaging for the delegates.
I am really looking forward to those. We had it in Amsterdam, and I was the one who brought up the topic, and it's just like, as someone who brought up a topic, I can actually share what that was. I was doing a project. I actually just finished it with the municipality of Rotterdam, and I was talking about how my research question was talking about the digital layer of a marginalized neighborhood here in Rotterdam, and it's my question was like, how can I bring up the topic of digitalization for a community that might not use that language? It's like that language gap. And I got such amazing feedback, so much using that collective intelligence in the room, because it's people from different backgrounds, different experiences. And it just got me to this point in which I could just take this feedback and immediately implement it. And it's all given from such a generous place. Like, nobody's there to say like, oh, you're doing things wrong. It's like, that's not what we're here for. We're here to grow together. And yeah, I think we have curated the room, curated the audience in a way that it's a small, intimate setting. Your like audience is not going to have that. I think you see it in bigger conferences that have thousands of attendees. Like, I have to talk to everybody. This frenzy. We actually get to know each other as people, which I think it's very, very valuable, and build relationships. And I think that's rare, and I think that's unique. I would say rare, so it's like unique and something worth giving a shot, worth attending. What do you think, Giles?
No, I totally agree. If you've not been to a UX healthcare conference, I highly recommend you attending. Of course, I'm biased because I've been there from the beginning, but still, like, it's loads of fun. It's so educational. It's so inspirational, and it allows you to be part of a community as well. It's very often the case that you, as a UX professional working in healthcare, you're going to be working on your own or working in a very, very small team, but also that team is working on very specific projects or just one project. Whereas when you come to the conference, you're going to be amongst a community of people working on all kinds of different projects, clinicians, patients, even non-clinicians and non-patients, but other people working still within the healthcare sector as end users. So yeah, that breadth of knowledge on experiences is great, but also recognizing that you're not alone. You've got kindred spirits there in the room with you.
Yeah, no, it's like, I think one of the people that we met at the conference, she was the first UXer at a very large organization here in the Netherlands. And like, we were talking about like how alone she feels, and it's very normal. It's like a service designer and UX and researcher. It's very normal to be the only person in the room that has those skills. And I think having access to a community like this allows you to find mentors as well, people that you can reach out to and say like, hey, I have this question, I don't know how to solve it. And meeting people face to face has a different impact. There are great platforms like ADP List, and of course you can reach out to people individually like Giles and just have an hour mentorship with him. But meeting them in person, getting that vibe check, can we call it a vibe check?
Yeah.
It's a very unique experience. And so you have been involved with UX healthcare from the beginning, and you have seen it grow, you have seen it develop. What's coming next? Like, what can you like give us a taste of what the plans for the future are?
So yeah, I'm really excited that we're planning for conferences now more internationally, because obviously we've been primarily focusing on conferences in Europe, and during COVID there were online conferences hosted for US audience as well as Australian, but we're going to be having live events as well now in America and in Singapore, along with what's happening here in Europe. So it's going to be a busy year, but really excited for that.
Yeah. No, it's gonna be fun. I think it's gonna be checking a lot of the cultural differences. It's like
Mhm.
going to these different places. It's every part of the world's gonna have their own culture, their own sort of restrictions, like of challenges that other parts of the world are not gonna have. That's why it's important to expand it a little bit and
Mhm.
not just saying like, oh, we're gonna go to the US for because it's the US. We're gonna go to the US because there's a unique community there that we want to learn more from and bring attention to more importantly. Then Singapore the same, a hub of innovation. They're looking to grow, they're looking to expand their healthcare systems. Let's be a part of that. Let's be a part of the growth.
Yeah, and as you've alluded to, like there's very unique work going on there that's tied to culture. And like when we look at Singapore, it's kind of a hub that's gonna draw attention even from China, Japan, but also Australia, New Zealand, and there's a lot of work going on in New Zealand. For example, they have EHR vendors there that supply other parts of the world. So it's really great to reach out to these other communities, other regions of the world to learn about what's uniquely going on. Because of course we could try and get speakers from Singapore to come to the UK to come to other parts of Europe, but it's quite a long distance.
Yeah,
So it's nice to appeal to the UX professionals working in that part of the world as well. So rather than them coming to us here in Europe, it's actually we'll go to them.
yeah, we get to experience it. You know, you get to like be there and see it and be like, oh, these are the language constraints. Like what I read this really interesting article about a service designer who was doing work in Asia, not speaking a language.
Mhm.
And it was really like, how do I talk to my users when I can literally not talk to them? It was the importance of translators, the importance of cultural awareness, like getting this, putting your own perspectives and biases like a little bit up in a box and put it
Yeah.
away, and just being a sponge and absorbing these new cultures and new places. So there's a reason to like be have this immersive experience almost. I mean, I'm not saying that one of us gonna get food poisoning so we can go to the emergency room and experience the emergency room, but immerse as safely as we can without
Yeah.
actually having a medical emergency.
Mhm.
But so to close, I would like to ask you like one like pop question: This, what are you excited about in the UX healthcare field? Like, what is something that makes you say like gives you hope? Because I think it's such a massive industry, and in many ways, it's legacy industry. So people jumping into it might be kind of overloaded at the
Mhm.
beginning. Like what there's so many issues, there's so many bugs to fix, there's so many problems to solve. How do I choose one? So what are you excited, what makes you excited about it?
Mhm. So what I find most exciting about working as a UX professional in healthcare, area of focus would definitely be digital therapeutics. And I've had this opinion for quite a few years now. And the main reason I always gravitate towards DTXs, digital therapeutics, is the fact that they really are the future of healthcare. This ability for people to go to their mobile phone, to their smartphone, as the first source of truth to improve their health. So it goes far beyond what we all call about Dr. Google. We mean a app or system that recognizes you as an individual, your holistic healthcare needs, using data that's been collected that either you've directly provided to the system or is collected from different wearable technologies, from your electronic health record system, and intelligently provides you with appropriate guidance on what to do in a given moment relating to your health. Do you need reassurance that the problem that you have actually isn't that bad? Do you actually need direction to go to the emergency department or to at least book an urgent appointment with your specialist or GP? Is it actually telling you how to change your medication, to change your treatment for whatever condition that you have at that moment of time? It's particularly powerful for chronic illness, but it's also useful for people who are time poor, people who are otherwise marginalized, people who are tech savvy, but also might be introverted. Like, there's just so many ways that such technology, digital therapeutics, can improve healthcare. It's just mind boggling. We've seen some successes, but we've also seen failures. The likes of Pear Therapeutics, when they came out with a suite of technologies to help people with different types of addictions, they burnt through cash and they went bankrupt, and the assets had to be sold off, even though they had FDA approved technology. So we can't see this as being easy. And because of these failures, it's meant that investment in this space has become a bit more tricky and harder to come by. But it doesn't change the fact that such technology has great power to positively improve health outcomes for the masses. And we need you professionals who have expertise in behavioral science, who understand behavior change methodologies, who recognize the importance of finding ways to keep people loyal to a solution and use it regularly to improve their health outcomes. And not just user interface design, but really understanding service design and UX design and how all of this in combination creates solutions, not just an app or a service, but an overall solution to problems that's going to improve healthcare for all. And another thing to add is that when we do this right with digital therapeutics, we'll be able to support the underserved, people who are marginalized, people who are forgotten by healthcare at times, people who are dismissed by healthcare at times, and really make sure that everybody who has a health problem, and that's everybody deserves to be healthy, that we
Mhm.
all get our health needs met and we all live better, healthier lives the world over.
What a way to finish. What a way to finish this interview. It's like in a very uplifting note. And I think what I took away from that personally is that there's space for everybody.
Yes.
It's like some feels like if we like want to talk like you mentioned before how the job market, like in the beginning, how tricky the
Mhm.
job market is right now. We like this space for everybody. There's more than enough illnesses, patient groups,
Yes.
startups. Like there's more than enough work to be done. We just
Mhm.
need the people who are qualified and capable of doing that work, and more than nothing, passionate about it, passionate about that aspect of helping people and of serving the underserved. And just like to add some, just a fact, we are going to have, at least in the Netherlands and actually in Europe in general, a lack of healthcare workers because
Mm.
we're going to need to be able to make those decisions. It's like, do I need to go to a doctor now? Is it something I can take care of myself? Which doctor do I need to go to? Just because, like you said, everybody has a right to be healthy. Everybody has a right to that information, but the information has to be put out in a way they can absorb it and understand it. So, UX writers, we're looking for you.
Yes.
So, thank you so much, Giles, for your time and for this interview. I think it was great, and I hope to. Well, I'm gonna see you in Berlin
Mhm.
just in a couple weeks from the 19th and 20th of September. And your audience, thank you for listening to our interview, to our rants. I hope that you enjoyed it. And yeah, we'll and under this interview you'll find links to Giles. You have a little breakdown on this interview, to Giles and his work, as well as a link if you want to, yeah, Dr. Gyles Morrison. And you will also find a link to how to purchase tickets for Berlin. We have a lot of exciting things going on, and we hope to see you there. So thank you so much, Giles, for joining us, audience for listening, and yeah, we'll see you next time. Thank you. Have a great day.
Bye bye.